Good afternoon, everyone, and thank you for joining us for this afternoon's very important session on respiratory illness preparedness with guest speakers from Ministry of Long-Term Care. It's just a minute before our official start time. I'm just going to give folks time to come into the session and get settled before we start with opening remarks at promptly 1:30. All right, good afternoon, everyone, and thank you for joining us for today's important webinar on respiratory illness preparedness, information session for families and caregivers. My name is Sam Peck, my pronouns are she and her, and I am the Executive Director of Family Councils of Ontario. So it's my pleasure to be welcoming you to this afternoon's session. Before we get started, we're just going to do a land acknowledgement. Now, while we're meeting on a virtual platform, we are all on Indigenous land in Ontario. I am coming to you today from Hamilton, and Hamilton is situated on land of Indigenous peoples, specifically the traditional territories of the Erie, Neutral, Huron-Wendat, Haudenosaunee, and Mississaugas. It's also land that's covered by the Dish with One Spoon Wampum Belt Covenant. And that was an agreement between the Haudenosaunee and the Anishinaabe to share and care for the resources around the Great Lakes. And since that time, other Indigenous communities and settlers and descendants of settlers like myself have been invited to participate in this agreement so that we together can continue to care for the natural resources that enable us to live, work, and care on this land. FCO's work, the work of family councils and long-term care homes, takes place on Indigenous land. And in order to work towards reconciliation with Indigenous peoples, we first need to start with truth. And so, as one small step in your journey, I invite you to check out an amazing website. It's called native-land.ca. On that website, you can type in your address, and it'll actually tell you and show you the traditional Indigenous territories that you're situated on. You can learn more about the peoples, the treaties, the languages of where you're situated, where you're living right now. It's an amazing way to start learning about the history of the land and its peoples. We give thanks now to the Indigenous, Métis, and Inuit peoples of the land we now call Ontario and Canada as a whole. And FCO, we're committing to working with Indigenous partners to better understand their experience so as to improve our work and to understand how we can work together authentically in the spirit of collaboration, relationship building, and truth and reconciliation. There's only through working together that we can create a better now for people living, working, and caring in long-term care, and a better tomorrow as well. So thank you. A few housekeeping and logistics before I turn it over to today's speaker. You'll notice you're all in listen-only mode. So you can hear us, but we can't hear you. So if there are any challenges in your experience today, you'll be able to chat with myself, the host. So use the chat window, or chat feature, if you have any technical issues. We have protected time for an interactive Q&A at the end of the session. So I'm sure you'll have questions for our guest speaker today. Please use the Q&A feature in your Zoom webinar. You can find that at the bottom of your screen where it says Q&A. Chat only for if you're having issues with today's session. Today's session is being recorded and will be made available on the Family Councils Ontario YouTube channel. And the information about the recording and the slide deck will be published in an upcoming e-bulletin. If you don't already receive our weekly e-bulletin or newsletter, please check out our website at fco.ngo for those details. So now, without further ado, I'm going to turn it over to our speaker, Christine Loureiro, who is a director with the Ministry of Long-Term Care. And Christine will be walking us through the respiratory illness preparedness information for families and caregivers. Christine, over to you.
Thank you so much, Sam. And thank you, everyone. I'm so pleased to be here today to share information on the Ministry of Long-Term Care's plan for readiness for this respiratory illness season, and to have an opportunity to answer some of your questions. I am joined by some of my colleagues today as well, Anne-Marie and Rena, who might support in answering some of your questions and are helping with the screen sharing. So we can move to the next slide, please. I wanted to first begin by providing a picture of this year's respiratory illness season. We do anticipate, similar to last year, a challenging respiratory illness season with the flu, RSV, and COVID all circulating. And we've certainly seen an increased number of COVID outbreaks since mid-August. Although, as of right now, flu and RSV are still remain low in terms of activity in the community level, but we do anticipate that to increase over the fall. The risk of severe outcomes to residents due to COVID-19 has been significantly reduced due to the great uptake of vaccines, the availability of safe and effective antivirals, as well as high community level immunity. In addition, long-term care homes have robust infection prevention and control measures in place, which also help to reduce the risk and impact of outbreaks. So we continue to work closely with the Office of the Chief Medical Officer of Health to monitor the trends and projections over the respiratory season, and assess whether any further preventative actions or mitigation actions are needed to optimize the health and well-being of those who live and visit and work in long-term care homes. Next slide, please. So in terms of some of the key infection prevention and control practices in place, one really key critical one is proper hand hygiene, remembering to wash hands before and after meals or group activities, using soap and water or hand sanitizer. Masks are also strongly encouraged for everyone in common areas and for staff when they're working directly with residents. Staff are required to wear masks and PPE if there is a risk of exposing themselves or others to an infection. And residents can certainly request that a staff wear a mask when providing care if that's their preference. Homes must also provide PPE for staff, residents, and essential caregivers and visitors. And we also strongly encourage everyone who's attending to the home, whether it be to visit or to work, to self-monitor for symptoms and not attend the home if you're not feeling well. Next slide, please. In terms of vaccines and therapeutics, getting your COVID-19 and influenza vaccines is the best way to stay protected for yourself and for your loved ones living in long-term care homes. They've been really effective in preventing severe illness, including hospitalization and death. In terms of eligibility or the recommended interval for when to get the vaccine, the recommendation is to receive the COVID-19 vaccine 6 months after your last dose or last infection, but it can be provided at a minimum of 3 months from a last COVID-19 dose or infection. And residents or yourselves are encouraged to speak with your healthcare provider in terms of the vaccine if you want more information. In our in our regulations, homes are required to offer COVID-19 and flu vaccines to residents, and we do encourage homes to also consider how they might be able to offer vaccines to staff and to caregivers when they are organizing clinics. So something for you to speak to your home about if that's something they're able to offer. We also do recommend receiving the COVID and flu vaccines at the same time. It is safe and it's encouraged. You can receive the COVID and flu vaccines whether on the same day or one before the other. Data has shown that that is safe to do and remains effective. Another new vaccine that's being introduced in Ontario is a new vaccine for targeting RSV. RSV is a respiratory illness that generally affects more severely young people and seniors. So for this RSV vaccine, residents over the age of 60 are eligible to receive the RSV vaccine. The rollout should be coming out anytime now. We know the Ministry of Health is working closely with public health units to get supply out across the province, and then those public health units will be working with homes to ensure they have access and can offer the RSV vaccine to your loved ones in long-term care homes. One note here is that the RSV vaccine should be given with at least 14 days between any other vaccine being offered. And one last point on therapeutics. So there is, access to antivirals such as Tamiflu and Paxlovid to help treat respiratory illnesses when someone is sick with the flu or COVID. And we have encouraged homes to pre-assess residents for eligibility to receive those antivirals. So once a resident, if they do become infected with COVID-19 or flu, they can access treatment quickly. Next slide, please. Now, I know something we often get questions about in the ministry, and does have an impact on residents, is when there is an outbreak and what happens when there is an outbreak, and how is an outbreak declared, and what are the measures that are in place once an outbreak is declared. So during an outbreak, additional measures are applied, usually in consultation with the public health unit. So the home will work closely with the public health unit to identify what are the appropriate measures based on the specifics of that outbreak. So some of those measures include self-isolating residents who are sick, and those isolation periods may vary based on different infections. For COVID-19, the guidance is still a 10-day self-isolation period, but residents whose symptoms have improved, if they have no fever, and if they can wear a well-fitted mask throughout the home, they may be able to leave their room as early as 5 days after infection. So that is a kind of a newer update in the past several months to help reduce the length of time that people are having to be isolated for once they are infected with COVID-19, but still maintaining those good protections and ensuring that we're not further spreading COVID-19 to other residents. In terms of a close contact, for a roommate, there continues to be a need to isolate, to wear a well-fitted mask, and to physically distance from others as much as possible when outside of their rooms, and are encouraged not to visit other areas of the home where other residents maybe have not been exposed, again, to reduce the possibility of further spread. If no symptoms after 5 days, they may discontinue isolation and resume kind of normal activities. All other close contacts do not need to self-isolate if there's no symptoms, but they should follow some protective measures such as wearing a mask if tolerated, or physically distancing if that's possible. Next slide, please. Okay, I spoke a little bit about this already, but in terms of declaring the outbreak, that is the responsibility of the public health unit to declare when a home is in outbreak, as well as when the outbreak is over. The home's outbreak management team works with the local public health unit to manage the outbreak response based on that guidance, so some of which we just spoke about. So that includes, cohorting and isolating, and including masking across the home. One point is that homes cannot deny access to essential caregivers. Essential caregivers can continue to visit their loved ones during an outbreak. However, the public health unit may advise against some restrictions related to general visitors, again, to help reduce the spread of the outbreak. Next slide, please. I think, do we speak about this? I think the slides. So some additional outbreak measures that maybe I haven't spoken to yet. We talked about cohorting, the use of PPE. Another piece might be shifting from larger group activities to smaller group activities, as well as increasing cleaning in the environment. So again, the home will work closely with the public health unit to determine what is most appropriate based on the specifics of that outbreak. So again, I think that's perhaps our last slide. I just want to end by saying, so those are the main things that are in place over the respiratory illness season. The ministry closely monitors the trends with the Office of the Chief Medical Officer of Health to determine if any other changes might be needed. So we're continuously reviewing the trends and assessing what are the most appropriate measures to be in place, really recognizing the impact that some of the restrictions and measures have had over the course of the pandemic. And really our focus is prioritizing not only health and safety, but that overall well-being and wellness of residents, and wanting to ensure that they're able to visit with their loved ones, and share meals, share special occasions with their loved ones, and really prioritizing quality of life as well. So again, we continue to monitor, but these are the kind of current measures that are in place based on the current situation in the respiratory illness season. So we had a fairly short presentation. Happy to answer any questions, Sam, as they come in, and thank you for helping to facilitate.
Wonderful. Thanks so much. So we've had a few questions come in. One that I'm just going to repeat is, so this session is being recorded and it will be posted on the FCO YouTube channel. And you can find a link to that on the homepage of our website which is just www.fco.ngo. So for those who'd like to rewatch, it'll be posted there. And you can also sign up for our e-bulletin on that site. So a few questions that have come in, Christine. So thanks for that overview. So there's a couple questions about vaccination. So there are homes that will only vaccinate at the 168-day mark. So from previous vaccination or infection, 168 days out, whereas your slides say it's a 90-day minimum. So how would you encourage caregivers and councils to request or to advocate for homes to have earlier vaccination between the 90 and 6 month, 90-day and 6 month mark? Who do they talk to?
Sure. So I think first I'd like to respond. So one, thank you for the question. It's a great question. The general advice and recommendation we receive from our public health experts is really recommending the at a 6 month interval, which I think is around the 168 day, if my math is is correct on that one, but around the 6 month interval. They're certainly eligible to receive it beforehand, but we do encourage residents or family members to be speaking with their healthcare providers to see if that makes sense for that person. There might be good reasons to do it sooner. There might be good reasons to do it closer to the 6-month mark. I'm sure also for some homes, they are trying to plan their clinic so they can do a group of they can vaccinate a group of residents kind of at the same time when they have the supply in the home. So there might be some logistical pieces to that as well. But yeah, I wanted to kind of mainly send the message around the kind of recommendation that we've received is really the 6 months from the last dose and from the last infection is kind of the recommended advice. So it could be that the home is following that guidance, but again, you can speak to your loved one's healthcare provider to see what might make the most sense for that particular individual, and that might be an earlier vaccine.
Great. So another question about vaccines. What if the medical director of the home issued a directive that there has to be a 14-day break between the flu shot and your COVID vaccine? The person asking has the understanding that the break is actually between the RSV and vaccines, and that influenza and COVID vaccines can be given together. So is that true? I think you said that you can have both at the same time. And what if the medical director of the home is saying something contrary?
Yeah, thank you for that question. So certainly any individual is able to receive their flu and COVID vaccine administered together. Evidence has shown that it is safe and effective to do so. However, we have heard that there are homes that are choosing to keep 2 weeks between offering the two vaccines, and there may be a number of reasons why they are choosing to administer the vaccines that way. It is also safe and effective to do it that way as well. If you have concerns about that approach, please connect with your home's healthcare provider, their director of care, your family member's healthcare team to talk about it. But it is also perfectly safe and effective to receive the flu and COVID vaccine 2 weeks apart. The Ontario government has specifically recommended that the RSV vaccine, once that starts to roll out, that there is a 2-week period between the RSV vaccine and other vaccines. And that is mainly to monitor for any potential side effects that might come out of from the RSV vaccine. If there were to be any, and if you combine vaccines, you might not know which vaccine it's coming from. So again, the RSV vaccine has been proven to be safe and effective, but that's one way that the province can really monitor the safety piece if in the event there are any adverse reactions or allergic reactions, etc.
So between RSV and other vaccines, 2 weeks, but influenza and COVID are safe to administer together.
Correct.
Could families take their loved one to a community clinic? Does the resident have to receive their vaccinations in the home?
That's a great question. There are a number of pharmacies, for instance, that offer vaccines to everyone, to the general public. So, long-term care residents aren't forbidden from accessing vaccines in the community in that way. But one of the benefits of doing it in the home is then aware of their full, what vaccines they received and when. So I think just ensuring that the home is aware of when and what vaccines have been offered, so that's documented in their files, would be really important.
Mm-hmm.
I also just want to mention too that if they do get a vaccine in the community, is to let whoever is vaccinating them know that they're coming from a long-term care home, so that it does get captured in what we call COVAX. Mm-hmm. So we can again follow how many people in a long-term care home have received their vaccine. So the name of the home and obviously that they're from a home.
Excellent. Good point. Thanks, Rena. So quite a few questions about vaccines, so I'm going to keep to those grouped together. Does the resident have the right to choose the manufacturer of the vaccine that they wish to receive, especially if we're looking at the monovalent vaccine coming out for XBB. So if the resident prefers Pfizer or Moderna for whatever reason, do they have the right to choose that?
Rena, you might have something to add to this, but generally a home would be working with the public health unit to receive a particular vaccine. Certainly the XBB vaccine has been prioritized for long-term care homes, whether it's the Pfizer or the Moderna. But Rena, is there any specifics you wanted to add to that?
Yeah, no, there is either Pfizer or Moderna. They're both effective vaccines. So the delivery to the home is going to depend on what's accessible. So how much does the public health unit have in their inventory? But there's no difference between either manufacturers.
Okay.
Thank you, Rena.
So about pricing for cost for the RSV vaccine, is that free for long-term care residents? And what about for their caregivers or family members?
So my understanding, and Rena, you might, so for sure for those in long-term care homes who are eligible, the provincial program is covering the cost of the RSV vaccine. For the general population, Rena, can you speak to that, please?
Yeah, sure. So for anyone over the age of 16 in the community will have to pay for the RSV vaccine. They're eligible, but they will have to pay. Caregivers in long-term care homes will not be offered the vaccine. It's only for the residents in long-term care, not the staff nor the care providers. But anyone over the age of 60 in the community, and it's approximately about $240.
Okay. All right. This is more of a general advice question, or what you would recommend. We hear about vaccine exhaustion, about folks needing to keep up with their vaccination schedules, and having more vaccines than we did prior to COVID. What do you recommend if a resident just says, or a family caregiver says, I'm exhausted, I've had so many, I just don't want to do this? What do you recommend to encourage vaccine uptake, because it is such an important measure for preventing severe illness?
That's certainly a common question, and we've been hearing that not just related to long-term care homes, but I think across the general public. I know certainly I have friends who have said, I don't know, I don't know if I'm going to get the vaccine this year. I got COVID and I didn't even get very sick. I'm like, that's because you got vaccinated. So I think encouraging people and reminding them that the vaccine has been instrumental in protecting in preventing serious illness and hospitalization. So yes, we are still seeing some outbreaks, we are still seeing infections, but the seriousness of those symptoms has been significantly reduced thanks to vaccination. And we do see the vaccine does start to wane in terms of its immunity protection. It's not the same for everyone, but let's say generally around the 6-month mark, which is why we recommend getting a booster after the 6-month from your last shot. And so to maintain that level of protection, getting a fall booster is very important, especially in individuals who are perhaps more likely to experience serious illness or serious outcomes from an infection.
Mm-hmm. So we talked about going back to getting COVID and flu shots at the same time. So you mentioned that they're safe, it's effective to be administered together. But what if you have someone who may have had some side effects from the previous vaccines, or sort of not wanting them to be offered together? So it's still safe and appropriate if someone says, I want my vaccines, but I want to space them out.
Again, I would strongly encourage that person to be speaking with their home and their healthcare provider about that, especially if they had any kind of reaction after their last one. I think that's a great conversation to have with your healthcare provider and the person offering the vaccines. And I'm sure many homes would work with individuals to accommodate as they can, especially where there might be, some concerns around side effects, etc.
Great. And will the RSV vaccination be another annual vaccine, recommended or required annually?
That's actually a very excellent question. I think that's still something that we're waiting to hear more from. What I understand from the clinical trials is that the RSV vaccine does seem to have a longer duration in terms of its effectiveness. So it might not need to be an annual vaccine, but that's something that we're monitoring in terms of this season's rollout and kind of going forward and what the program might look like on a year-to-year basis. Rena or Anne Marie, anything to add kind of more recently on that, or did I get the latest?
No, they're still looking at the trial cases. So they're hoping by the end of this year, maybe to have more, evidence as to how long the vaccine. But as Christine said, they're sort of tilting now towards not annually, but we'll see once all the information is in.
Great. Excellent. So now switching slightly to outbreaks. So a few questions around communicating the status of an outbreak or infection. So if a resident comes down with COVID, the flu, or RSV, is their family member or their substitute decision maker notified right away? Is there a requirement under legislation or regulation for that communication?
So I think, Rena, I might call on you in terms of the specifics on the regulation, but I know the ministry does, there are expectations in terms of how, someone's communicated with, some of it's articulated. Sorry, Rena, I heard you kind of jump in there. Maybe you wanted.
No. Certainly what happens in long-term care homes is that the substitute decision maker or the essential caregiver, will be notified with change of condition of a resident. They don't call all the family members, that kind of thing. It's who is the designated person for that resident. And so, yes, the legislation does say that, a change of condition, they should be notified. It may take a day, it may take 2 days, that kind of thing, may take a couple of hours, depending on the situation in the home and how big the outbreak might be. But that's one thing that we have spent some time on over the last couple of years is to, get in touch with those family members, communicate with those family members as quickly as possible.
Mm-hmm. Okay. So questions about outbreaks still. What constitutes an outbreak? So current, what are the current guidelines for what actually constitutes an outbreak within a long-term care home?
So an outbreak is usually defined when there are kind of two COVID cases in the home that are linked. So if they can be linked, and it's not kind of two people that have never kind of interacted. So there needs to be, they'll use the term epi-linked. So two cases that are linked is when an outbreak might be declared.
Mm-hmm. If there is no outbreak in a home, can the home require essential caregivers to wear a mask when they're on site in the long-term care home?
Yeah, so the ministry sets out minimum requirements in terms of what homes need to follow on infection prevention and control, and we have specific guidance on COVID-19. Currently, the ministry's minimum guidance strongly encourages masking of caregivers and visitors in the home. A home could certainly go and could certainly implement additional measures based on their local circumstances. Perhaps there's a lot of COVID circulating in their community, etc. So a home, can do that. We do encourage homes to work with their family councils and their residence councils when they are considering policies that go beyond the minimum requirements set out by the ministry, and also consulting with their, local public health unit, because they do need to balance that with, other requirements, for instance, the broader Residents' Bill of Rights.
Mm-hmm. So it would be possible, let's say, if it's in a community where there is a lot of COVID or flu within the broader community, that the home could, say they get advice from public health or family or residence council, are encouraging proactive masking within the home. That is something that is possible under the current guidelines and regulations.
That's correct. So that is something that is possible. We do know there are some homes that are doing that, and in the hopes of reducing the risk of any outbreaks, because those also have impact on the well-being of residents and the people that are visiting with them. Sometimes it means activities are being paused. So I think most homes that have implemented it have really done it in the spirit of trying to reduce the likelihood of outbreaks and the impacts that can have on homes, on residents, and on staff.
Because an outbreak isn't just have health impacts, it also has well-being impacts, and you can consider well-being part of health, but specifically around psychosocial and social aspects of life.
Exactly.
Let's say a home is in outbreak and the home is going to be, let's say, cohorting or making changes to dining or to activities. Can a family take their person out of long-term care if, say, they don't agree with the measures that are being implemented within that home?
So there are provisions in the regulations around, so one, like a short-term absence is certainly permitted. If they're thinking of a longer-term absence, that's definitely something they need to be working with the home, because there are provisions around potential discharge if that's a really lengthy absence to be working through. So just encourage you to talk to the home around your concerns and any potential opportunities that you might want to have to remove the person from the home for an extended period of time. But certainly, like shorter term absences, people are welcome to go out into the community, go to a restaurant, visit their loved ones in their loved ones' homes, so that can continue even in an outbreak situation.
Okay. So moving on to Paxlovid, is that available if a home is in outbreak? How is that made available to long-term care homes?
Yeah, so all long-term care homes have a pharmacy that they're contracted with, and that supplies all the medication that residents have access to. So long-term care contracted pharmacies would have a supply of Paxlovid on stock, on hand, in the event of an outbreak, of a resident contracting COVID-19. What we've encouraged homes to do, and I know many have, is to pre-assess residents for eligibility and suitability for it. There are some things to consider with Paxlovid in terms of interactions with other medication that they need to be considering. Rena, is there anything else you wanted to add to that one?
No, I think you hit the nail on the head. It's that pre-assessment, which is really important, because Paxlovid has to be given within 5 days of the onset of the symptoms. So it's really important for that reassessment. And then, of course, it's a physician's order, and then the Paxlovid starts.
Mm-hmm. And it would be the physician who would be determining if if it can be administered, if someone's already had it before for a previous infection and whatnot.
Yeah.
That's a medical.
Usually the physician and the pharmacist work together, to look at any contraindications with medications that residents might be on. But they do need a physician's order. In a long-term care home, it's different. In the community, you can go to your pharmacy and ask for the Paxlovid as long as you have a positive COVID test. But it's a little bit different in long-term care, because you have registered nurses who are giving, and we need to have a physician's order to be able to give residents medications.
Yeah. Okay. So ultimately, if there's any questions about Paxlovid being given, it's, a medical order and families would need to follow up with the physician or other medical healthcare staff at the home. All right. So now turning to questions about staff who come down with COVID, or their family does, or someone who lives in their household. How long would staff be off work once infected with COVID? And are there any, or what is the direction around amount of time symptom free and or masking once returning to work?
Yeah, great. Thank you for the question. So staff now, if they have symptoms of COVID-19, or if they've tested positive for COVID-19, they can return to work once their symptoms have been improving for at least 24 hours, 48 hours if they're gastro type symptoms, and that they have no fever. But they are required to wear a mask for 10 days from the date their symptoms started or their positive test. So even if they do return to work, let's say at day 4 or 5, they are required to wear a mask for the full 10-day period. So that was something that changed a few months ago in terms of the guidance. Last year around this time, the guidance was recommending staff stay kind of isolated away from work for a minimum of that 10-day period. But that can also present some staffing challenges in terms of providing the right level of care in the home. And then we're also hearing on a number of staff whose symptoms, they weren't lasting the full 10 days. So this was an opportunity to bring staff back to work sooner, but still have some measures in place.
Okay. Are there any measures in place, say, if it's not the it's not the PSW who's ill, but someone who lives in their household with them is ill, say if it's a flu or COVID or whatnot, are they required to mask when they come back to the home, just in case they might be ill, or are there any directions there?
So staff are required to mask based on a point of care risk assessment, which looks at the risk of either they themselves, becoming infected through that interaction with the patient, or thinking about exposures that they may possibly have had and passing that on to someone else. So in that situation where maybe they've had close contact with someone who's COVID positive, as part of the point of care risk assessment, which they should be doing as part of their normal routine practices before every interaction with a resident, they likely would be, wearing a mask to help prevent any transmission.
Mm-hmm. So, but it's not, there's no universal masking at this time for caregivers or staff. Also, thinking about how residents felt, it had an impact on their well-being if everyone around them was masked. So are there any universal masking approaches implemented right now? And does that differ if the home is an outbreak or not?
So currently we do not have a universal masking requirements. So masking right now in our guidance is, again, for staff based on that point of care risk assessment. Staff are encouraged to wear a mask if they are going to have prolonged direct contact with a resident. And again, thinking about that point of care risk assessment, the change to the masking policies really were kind of reflecting on the impact that masking can have on, the staff resident care relationship, in addition to the impact that it was having on, relationships with loved ones. There's also that, the impact in particular for, residents who have hearing impairments or residents with dementia, having the mask really impacted on kind of communication and on that relationship. So that's the current measures in place now. Certainly that's something we, continue to monitor the status of the respiratory illness season and consider very seriously in terms of, should there be a right time to reintroduce additional masking requirements based on what we're seeing in the trends and the projections over the course of the season. But yeah, currently, not a universal masking requirement is not currently in place. Yeah, and then for staff or for visitors and caregivers, again, we encourage and recommend that masks are worn in common areas. It's not required, but just something to be mindful of if you're in a room, especially if you as a caregiver or family member have recently maybe been around other people who are ill, even if you don't feel ill yourself, just thinking about everyone in the home and trying to reduce the risk of introducing COVID-19 into the home.
Mm-hmm. So masking optional, staff do a point of care assessment, but there's no universal masking right now. So just point of clarification around staff who are coming back after being off ill. So does this mean that, so you mentioned that 24 hours after symptoms improve. Does that mean staff are going to be working while symptomatic, or is the goal that they're not symptomatic while at work?
No, they should not be symptomatic at work. So their symptoms should have improved before they're coming back to work. Some people, they might have a lingering cough that lasts for 3 weeks. That certainly doesn't mean that they remain infectious for that length of period of time, but it is still possible, within, especially those first 10 days, that people are infectious. And that's why the recommendation, or not the recommendation, but the requirement, if they are returning to work within the 10-day period, to wear appropriate PPE and to be masked.
Okay. And there's no requirement currently for staff to be vaccinated?
There's no ministry requirement for staff to be vaccinated. Now, some homes may have their own individual employment policies, but there is no current ministry requirement for staff to be vaccinated.
Okay. Switching to outbreak tracking and reporting. Are long-term care home outbreaks being tracked by the Ministry of Public Health, and are these reported publicly?
Sorry, can you repeat the question?
About outbreak reporting. Are outbreaks at long-term care homes, whether in a neighborhood, a unit, or home as a whole, reported to government or public health? And related to that, are outbreaks reported publicly? So will the public know ABC home is in outbreak and it has since resolved?
Yeah, so homes are required to report to the ministry as soon as an outbreak is declared. So there's a direct reporting requirement for homes to do that to the ministry, and we monitor that closely. Homes also, they work with their public health unit. So it's the public health unit who will declare an outbreak. And then the public health unit has a requirement to report that information to the Ministry of Health. So there is some data available in terms of the number of outbreaks, across the province, how many weekly new outbreaks by different settings, and that's based on information that the public health unit has provided to the Ministry of Health. And a number of public health units will post information on their websites in terms of which settings are in outbreak within their regions.
Okay. So speaking about the relationship between homes, ministry, and public health, what if a caregiver or a resident or a council thinks that the directives that are being issued to the home or that they're implementing contradict ministry or public health advice? So if a family or a resident has a concern, or staff has a concern about what the home is implementing and going against guidance being provided, who do they talk to? Who can they bring this to?
Yeah, so one, I would certainly encourage them to speak with the home and raise concerns that way. But also, if they feel that the measures being put in place contravene the act and regulations, for example, the Residents' Bill of Rights, we do have our LTC kind of complaint and action. It's called the support and action line. So we can certainly make sure everyone has access to that phone number. But there's an opportunity you can, file a complaint with the ministry that goes to our inspections area, who will review every single complaint that comes in. It does get triaged based on the kind of level of severity in terms of the complaint, but they're all reviewed and acted upon according to that kind of triaging and prioritizing based on severity of the risk.
Okay, thanks. So just a warning for folks, we've got about 10 minutes left in our allocated time. Please get your questions in now. If it's a duplicate of an earlier question, we may not address it because it's been addressed, and you can check out the recording if you missed it or want to look back. But please do get your questions in. So question, if there were going to be changes to the guidance or requirements, let's say universal masking, cohorting, what have you, how much notice is going to be given to homes in the change of a ministry directive? And then by extension, how much of a heads up would caregivers get to a change in those approaches?
Yeah, I mean, it's like a hypothetical question in terms of that notice period. I would say it might depend on how quickly and the urgency for action, depending on what we're seeing, and then balancing that with the need to provide advance notice to homes so they come into compliance with our new requirements, and providing an opportunity for homes to communicate with their home community, which includes residents and family members. We, in the past, the last few changes, we have tried to give a week notice between when the changes were communicated to homes and when homes were required to comply with those new requirements. So we do try to kind of balance the, if we're seeing something though that is extremely concerning and requires that urgency of action, that might be a shortened window, but we do try to give kind of a 1 week notice period if possible.
Okay. So speaking about reporting to for an inspection, is it possible to submit an anonymous complaint to the action line, or does there need to be a name attached to, just if families are concerned about reprisal?
Yeah, Rena, do you want to speak to this one? I know usually when they're inspecting, it's helpful to have like specifics so they can be investigating or inspecting on the specifics. But Rena, can you speak to that, please?
Yeah, sure. So, what happens is when we go into a home, when the complaint comes in, or a concern comes in, it can come in anonymously. It's difficult though if we don't have the resident's name, because we really do want to try and look at the specifics, right? If we have the resident's name, what we do is we will pull 3 or 4 different files, so the home doesn't really know who it is that we're actually inspecting. So we try and be as anonymous as possible. Sometimes it's not possible, but we absolutely try our best.
Okay, excellent. And let's say the complainant is dissatisfied with the result. Would that then, because there are offices of last resort, so there's the patient ombudsman and the Ontario ombudsman, but they would, in order to lodge a complaint there, it has to go through the home, any other agencies and organizations first, right? So obviously, if they're not happy with the ministry response, then that would go to the Ontario ombudsman, and a local home issue goes to the patient ombudsman. Just to clarify, if they're displeased, what would be the next step in the process?
Yeah, I mean, if they remain displeased, like I think even if they went directly to the ombudsman's office, the ombudsman's office usually will work with the ministry to better understand the situation. But yeah, so, and I think, I don't know, I actually don't know the answer between the patient ombudsman and the Ombudsman's office. I don't know, Rena, if you know which one gets directed.
Yeah, no, I'm
There.
not sure because usually any concerns that would go to the Ontario Ombudsman. And again, as Christine was saying, that depending on what the concern is, so the Ontario Ombudsman has a criteria of what they're able to investigate. And if a complaint falls under that, they will send the concern complaint to us, and then they will do a follow-up to make sure that we've responded to that concern or that complaint. So there is sort of tracking of it and making sure there is a resolution.
Okay. Because really, the ombudsman offices are looking for a fair resolution, not to blame
Absolutely.
either party, but really to get something resolved in a satisfactory manner.
Absolutely. And I mean, that's also, the Ministry of Long-Term Care. We want to make sure that residents, are well looked after, cared for. Again, this is their home, so it's very important.
Okay. Yes, and just we can't get into the nuance and the details of inspections, complaints, ombudsman offices at this point, but just to point out that there are options for folks to elevate a concern and seek a fair resolution to an issue. We've only got a few minutes left, and so I'm going to take the last two questions. If there is an outbreak in a home, does that have an impact on admissions from hospital or the community?
So it can, but it doesn't have, it might not, the short answer. So Ministry of Health has provided guidance to public health units to help support homes and hospitals when we're talking about the admissions process around what to do if a home is in outbreak and admitting into a home that's in outbreak. So it is possible, but there are some additional considerations. If it can be avoided, that'd be preferred, but some of the outbreaks, sometimes they might go on as, like maybe there's one or two additional cases, but it's a fairly well managed outbreak, as opposed to, an outbreak where maybe there are, multiple people, and maybe there are staffing concerns because a lot of staff are away. So there's a number of different things to be considering kind of in that situation. So certainly not ideal, but it's not impossible. It requires the local partners. So, home and community care, the public health unit, the hospital, if it's a hospital admission in the home, kind of working together on those specific circumstances.
Great. All right, last question. Our time together has flown by, but I think this is a great one to end on. What is the best way for family caregivers to stay abreast of updates and announcements from public health? And what do you recommend for getting information that's home specific versus an entire region or the province as a whole? What's your advice for people who really want to stay up to date on announcements?
Well, I think first and foremost is if your home has a distribution list where they're communicating with family residents, make sure you're on that distribution list. Maybe your family council or residence council is also supporting some communications. So I think looking at what's available within your home community is great. Many public health units have really great websites that have additional information. I will say it's not consistent across all the 34 public health units in terms of the level of information available, but some of them have really great information. Also, the Public Health Ontario site is the one that provides kind of the aggregate, like the province level view. So if you're interested in seeing kind of what's happening at the kind of provincial level in terms of how many homes are in outbreak or other settings, that's also something you can look at. But I think really, if you're looking for information specific to your community, I think between your home and the local public health unit website, those are really great resources for you.
Great. So yeah, stay connected with your local public health, with the home, obviously. Make sure you're on the FCO newsletter as well for province-wide updates. All right, so I'm going to bring the session to a close and say a big thank you to our speakers and the supports from MLTCA. So Christine Lorero, who is a director with the Ministry of Long-Term Care, Rena Bowen, Anne Marie and Catherine, who've been supporting them on the back end to make things go so smoothly today. Very, very much appreciated. So on behalf of the entire all the attendees, the FCO team, thank you to Christine, Rena, and the team. Any final closing remarks, Christine?
I just want to say a huge thank you for the opportunity to speak with you all today. I really appreciated the opportunity to answer your questions. I hope you found it helpful and look forward to doing more of these.
Wonderful. Thanks so much. So to the folks who have joined us, thank you so much for spending the past hour with us on this wonderful October 26th, 2023. So once again, this has been an information session on fall illness and outbreak preparedness. So this session has been recorded and will be available on the FCO YouTube channel. Check us out at fco.ngo. And there you can sign up for our newsletter to get updates around other events, webinars, publications of materials, and more. So until we see you next, I'm Sam Peck, Executive Director of FCO. Stay well, keep in touch, and we'll see you soon. Take care, everyone.